thank you all for the chance to join you this way. I'm so excited by this project. I've been standing back in awe watching your colleague students organize this global effort to save lives. The first thing I want to say, it's going to work. This amount of energy using the science that you're relying on, the amazing work of Atul Gawande and Bill Berry and their colleagues in the WHO Safe Surgery Project, this represents a combination of science and will that's bound to work. Lives will be saved as a result of the efforts that you people are engaged in today. And I'm delighted that the Institute for Healthcare Improvement, in partnership with AMSA, can help add fuel to your tanks. I'm absolutely delighted. I want to give you a little bit of background, and then I'm happy to engage in some Q&A later on. Maybe it's obvious why we need to care about patient safety. I think you probably know the data. We have evidence not just in the U.S. but worldwide about defects in care through no fault, no intention of a wonderful healthcare workforce that affect the safety of patients every place, every day. Tens of thousands of lives are lost because of errors and problems in patient safety, and these problems are mitigatable. They can be improved. We can do a lot to make our patients safer, but we have to do that together. This is a matter of shared social responsibility. No single profession, no single individual can actually contribute substantially to the improvement of safety, except as part of a larger system where we work together to bring in designs and techniques and scientific understandings that make patients safer in all environments. Among the most hazardous of environments is the operating room, the surgical suite. And here we have the amazing work of Atul Gawande and his colleagues, who have in relatively short order, using modern human factors engineering and scientific study of communication processes and handoffs in the surgical suite, demonstrated to the satisfaction of peer reviewers in the New England Journal of Medicine the value of the surgical checklist as a mainstay tool for substantial reductions in injuries to patients perioperatively. We know that proper use of that tool, if you follow the evidence that a tool has accumulated, could reduce death rates from surgery by as much as a third in some circumstances, and injuries even possibly in half. Even if the actual harvest of introducing the checklist is a fraction of that, it still could be one of the most powerful changes we could make in the management of a very hazardous environment in healthcare around the world. This involves culture change. The adoption of a standard procedure, even one with as good a pedigree as a surgical checklist, is a difficult bar to cross. The habits of individual heroism, the authority gradients, and the time pressures and productivity pressures in surgery make it very difficult for even highly willing doctors, nurses, pharmacists, managers to adopt the surgical checklist as it should be adopted uniformly as a standard of practice. Health professional students can help in this. That's the perception that your colleagues around this table have had. I'm deeply indebted to the IHI Open School staff, Shannon and Jesse and others, and to the students who have come together to do this amazing effort to launch worldwide momentum, to Jordan and Shabnam and Dan and Andy Carson-Stevens. The energy you're pouring into trying to make students yet another very important resource for the improvement of care through the introduction of this checklist is astounding. The Check-a-Box Save a Life campaign is correctly focused on a particular intervention, the surgical checklist, and is suggesting to students all over the world different ways that they can help see this change enter our practice in responsible fashion by collecting data, by implementing the checklists in the OR themselves, by raising awareness among themselves and the teachers and clinicians with whom they work. And to do it together, students crossing the professional bridge, so it's not just medicine or nursing or health administration, it's all of us together. I'm thrilled to hear about the University of Manitoba, where nursing students are paired with medical students in this project. I understand there's a multi-professional rally going on today at University College London Hospital Trust. Activities like this, which put us all together on the same team for the introduction of safe practice, is a tremendous gift to our patients. It should be fun, it should be productive, and it should overcome some of the habits and barriers that we see in our industry to productive, even scientifically vetted change. Your colleague students here and others around the world have thought hard about ways that you can help. You'll have resources as a result of this campaign that will give you lots of suggestions about specific steps you can take in your surgical clerkship and at other times to help you become agents of change, productive change, collaborative change in the environments that you work in. Students out there already in the field are finding actually great receptivity. I've heard inspiring stories about students in hospitals and clinics around the world who have gone into the surgical area, have talked with respect and dignity with their teachers and colleagues, and who found nothing but open arms, receptivity to the idea that maybe it's time to make this particular change. Here in the IHI Open School, the Institute for Healthcare Improvement, AMSA, and the Steering Committee, there are resources, and we'll be backing you up. And if you use this campaign properly, you'll be able to access these resources to help you become more effective. Indeed, you're a resource. If each of you could please share your experience back with the Open School and AMSA, back to the campaign, so we can hear about best practices in student participation and leadership of change, we'll make those practices universal. What you experiment with in your local setting can become shared knowledge through the mechanisms of this campaign and the Institute for Healthcare Improvement and AMSA. Don't underestimate what you can accomplish. This is only a beginning. Even if all you did was take this now highly valuable new tool and practice into more general use in the environments that you're in touch with, you'll save lives and reduce suffering. You're going to make a great contribution through this alone. But I sense something bigger as afoot. There's close to 15,000 students worldwide now using the IHI Open School. AMSA has become a wonderful partner with its own massive reach to tens of thousands of medical professional students, and other students and other professions are joining as well. This is a massive opportunity to mobilize literally tens of thousands of people for the improvement of care in many dimensions, not just the surgical checklist. And I have a sense that this is going to be the beginning of something pretty big and pretty important. I also think that the schools and the faculties and the senior staff that you're all dealing with, far from resisting, will welcome this. They are excited by the students' excitement. This is infectious, and I think you're going to find partnership with your teachers and your colleagues in later stages of their professional careers. So congratulations on this work. I'm thrilled to be able to help in any way you ask, that in any way that I possibly can, and my hat is off to Atul and Bill Barry and others for pioneering the technology, and now to your student colleagues for taking this into action. It's absolutely wonderful. Thanks a lot, George.